Okay, everybody, thanks for attending this afternoon's session. My name is Colin Truesdale from Ipswich Evolve, and with me I have Damien Morris from Ipswich Hospital NHS Trust. And today we're going to look at really the implementation side of Evolve. So taking a new customer, in this case Ipswich Hospital, where we have implemented Kainos Evolve, and really where we have taken that subsequently within the next 12 months in this particular case. So just some quick housekeeping to start us off. So we've covered the introductions. You can ask questions at any time. So as we tested in our pre-session checks, you can hit the little question button in the toolbar that's now at the bottom right of your screen, and you can submit any questions. What I will say is that we will hold any questions to the end of the session, and we'll answer them there, answer them then, and we'll get through as many as we can. If we can't get through all the questions today because of time, we can certainly then email you with any responses, because I'll know exactly who's answered or who's asked the questions. And our session today will last about an hour. And today we're going to look at, well, I'll get to a quick introduction as to who Kainos are and what the Evolve product is. We'll talk about, obviously enough, Evolve at Ipswich and the initial selection of Kainos, right through to implementation and through to where we have taken it in the year since. So we'll talk about the procurement timeline, we'll talk about the activities for implementation, and then I really want to spend some time talking with Damien Morris, one of the clinicians at Ipswich, and how he has found the transition and implementation of the product and moving away from very paper-intensive processes through to getting rid of that, presenting all of the patient record on screen. We'll talk a bit about from Edith being the initial product that was created in conjunction with Ipswich, through to the final Evolve product as we now know it. And then we'll look at, well, in that year and beyond, what else are we doing? So apart from the core EDM, where else have we taken that Evolve product? And at the end, obviously, we'll have time for some questions and answers. And feel free to submit those at any time. And as I said, we'll scoop them up at the end and we'll answer them in one go. So about Kainos then. So Kainos was founded in 1986, really as a joint venture with ICL and Cubis, Cubis being the sort of business foundation arm of Queen's University of Belfast, and so it's very much staff and Queen's University owned. So we're a good medium-sized company, 280 of us, very much a focus nowadays on the health sector, and we've really had a background in public organisations like central and local government, also financial services organisation, with a very strong and healthy revenue. And so in the last 2 to 3 years, we've been very much focusing on the health sector. And I'll just run you through some of the customers that you can see on screen. Starting off with really the Evolve Clinical. So Ipswich is the one that we're going to be talking about today, but equally, hopefully you can see my pointer there, we've also been working with West Suffolk, and we've now started working with Clatterbridge Centre for Oncology as well, and so we're moving into the final implementation phases with those trusts. Those trusts are deploying what we call Evolve Clinical, which is the clinical aspect, obviously enough, of Evolve, so the patient records being brought online and viewed through an online viewer. But equally with Evolve, there's also Evolve Corporate. And so this is where departments like your finance department, your HR department, can also be leveraging the underlying technology that ships as part of Evolve for managing of information. So yes, Evolve Clinical is about the patient and about patient information, but equally you could also use the underlying platform to manage any unstructured information that you wish. And we've also done other pieces of work, like business cases, for example, as well. So we've worked with Connecting for Health on the interoperability toolkit, Chelsea and Westminster, Countess of Cheshire. We've worked with them in business cases as well. And so it's really been a very fast-paced 2 to 3 years, where we're starting to see a lot of organisations really starting to look seriously at the whole area of good information management, good information governance, and finally tackling the paper problem and the mountains of paper that the clinical situation actually produces. So about Evolve itself, what is Evolve for those who are unfamiliar? There are really 3 main aspects to Evolve: capture, information, manage that information on an ongoing basis, and then obviously the presentation of that information back to the end users. So in terms of capture, one of the main ways would be obviously enough the scanning of the paper-based information, so that could be correspondence, it could be case notes, and then equally the document capture. So for example, where a secretary types up a big long letter, we can easily electronically capture that without having to go through the paper stage, automatically ingesting it and placing it onto the patient record. And then Evolve is very much about tying your existing systems together, being able to bring in automatically via HL7 messaging, for example, from sources such as a patient administration system, your pathology, radiology systems. The main idea is try to bring more information into one source so that as a user, I don't have to spend and waste a lot of time clicking in and out of different systems, logging in and out, finding a patient, finding the right results. If we can bring that into a one-stop shop, it's a much more efficient way of working. And so once we have that information in, we've got electronic document management, business process management as well, so the ability to create workflow processes within Evolve, and having those workflow processes enhanced using electronic forms. And those are two of the main areas that Ipswich have really taken the core Evolve product and are starting to go into areas that we hadn't looked at before. And so it's very interesting to see customers really capturing and catching on to the idea of, well, I've got a really strong platform here, let's use it to actually solve some of the problems that we face with information generally, be it patient or other information. And once we have that information, obviously, appropriate security, so being able to lock down certain patients because there may be VIPs, being able to lock down certain types of information, so mental or sexual health records, being able to apply a different level of security on those, all the while being appropriately audited, so everything that you look at, every patient that you open, will obviously capture that information. Presenting it back to the user then, well, really the main one would be the Evolve clinical interface, which we'll touch on later, but also the integration with the corporate applications such as Microsoft Office to present for those users who are maybe not doing directly clinical facing, maybe working in finance or HR, the ability to then have that core Evolve repository exposed through different interfaces. The use of being able to play nice, if you like, with other systems like an electronic patient record, single sign-on systems, and context management systems, again helping to tie everything together, being able to search for your information, and any supporting services like administrative services or medical secretaries, again tie integration with items like Microsoft Office really are very, very useful there. So in terms of Evolve at Ipswich, if we quickly talk about, well, what is the context for Ipswich Hospital? Well, first off, congratulations to Ipswich. They are the medium-sized trust of the year for 2011. With approximately 500,000 paper-based patient records when KNOS first became involved and brought along the Evolve product. With roughly around 10,000 new patient registrations per year, so obviously enough. If you're adding 10,000 new folders, the size of your records library is just going to grow and be very much an uncontrollable beast. Whereas the introduction of an item like or a system like Evolve, trying to then stop those new patient records and new patient folders being introduced. So what were the initial drivers at the start of the work and at the start of the time with Evolve? Where has it come from? Initial drivers would be, well, the idea of multiple user access to notes, so you're no longer playing pass the folder. As a user, I can get access at the same time as Damien can get access if he's treating the patient in his department, or maybe he's preparing for a clinic. Reduction in unavailable notes. Yep, so if I'm treating a patient in a particular clinic and they maybe turn up at A&E and then the notes are still in the clinic, they haven't been returned back to the medical library. There's all sorts of issues just with pure logistics and practical handling of notes. Improved retrieval times, obviously enough. Once you start going electronic, the whole aim of the game is access to information whenever and wherever you are. And then security. So the ability to actually place at different levels of security for different patients, different levels of security for different types of information, reduction in delayed care. So again, the idea that if I turn up at A&E in the middle of the night, we're not having to send down to the records library, which in the case of Ipswich was a reasonable distance from the records library between A&E and the library, so we don't have to have somebody going in the middle of the night to do a hunt for a folder to bring it down to A&E. That information should be available immediately online. One of the big areas of wastage with any trust, or potential areas, is, well, notes not being available, leading to cancelled appointments, etc. The idea again is, yes, you have the notes available for you, and no delays at the point of coding, at the point of discharge. So we're not playing follow the folder. The information is directly with the coding team as soon as they actually need it to start up post-discharge coding. So in terms of the timeline for selection that Ipswich originally went through, back in August 2008, their business case for electronic document management was approved. They then did the invitations via Catalyst, now known as Buying Solutions, in October, and Kainos was one of the respondees. They received their responses in December. In January 2009, I suppose it was my first real involvement with Ipswich. It was the first communication days, the first demonstrations within the trust of the new system. They then did some reference site visits in February 2009, with final selection being awarded, thankfully, to Kainos in April 2009. But that's only part of the story. That's the initial procurement. What did they do then in terms of the implementation? So in May 2009, we began what we call the scoping workshops, looking at the different types of information, how long it needs to be retained, who it needs to be accessed by, how we're going to get it into the system, how we're going to get it out of the system, all of those sort of design aspects. Very important for the implementation and really the buy-in was the communications day at the end of September. And this is where we presented what would actually be rolled out, and we spent a day just talking to basically everybody within the trust. So there was a couple of hundred people throughout the course of that day coming in to see very quick demonstrations of the system. And I know that from Kainos' perspective, that was really key in user acceptance, and from Ipswich's perspective as well. It's where we got a lot of buy-in, and it's also a good way of doing quick initial training as well, just getting that base level of familiarity built up. We commenced what we call the model office, or we often term it the model clinic, and that was in mid-October 2009. And this is really a chance for the end users to come along and essentially kick the tires to see how they're actually going to use the system, what ways they're going to be able to interact with the information, what's going to work for them, what's not going to work for them, and starting to iron out any issues that we may see arising before final implementation. At the end of October, we created the scanning bureau, so we were starting to input any of the information into that model office system, with final scanning started at the start of November 2009. We completed the model office or model clinic phase at the midpoint of November, with a final go live at the end of November 2009. So starting to digitize the patient records, making them available for inpatients, for clinics, etc. So as you can see, from the point in May 2009 right through to the end of November, so you're talking about a 6-month period in which Kainos worked very closely with the trusts to design, to implement, and to really bed down that system before go live. And that, I know from talking to a lot of other trusts say that that's actually, wow, that's a very quick turnaround and a very quick win for Ipswich, and certainly we would be of the same opinion. It was great to have a trust that was so enthusiastic and so really, ready to go for it.